At Two Rivers Health, as naturopathic doctors who attend births, we get a lot of questions about what it's like to have a doula attend your birth and how can it help your birth experience to be better or safer. And there's a surprising amount of literature that's published and research that shows that having a doula continuously support you during your birth experience can significantly reduce your risk of having a C-section and of needing an epidural anesthesia. The other interesting thing that was shown in one study recently was that for the women who did choose to have epidural anesthesia, the oxygenation rates for both mom and baby were higher in the doula-attended epidural births versus the non-doula attended epidural births, meaning that even the presence of a doula seemed to have a beneficial effect on how the baby and the mother were even managing that anesthesia. And I found that really interesting and kind of exciting. It certainly corresponds to the research that happens after births where doulas attend, and about 100% of couples who have doulas attend their births express satisfaction with those experiences regardless of the outcome. Now, in some of the most recent literature, having a doula attend a birth has been shown to reduce the odds of having a C-section significantly. So about 22% lower odds of having a cesarean delivery if a doula attended the birth. Why would you want to avoid a C-section? Well, C-sections are considered to be major surgery. They have significant risks to them, and of course, we have really high safety rates here in Canada. But overall, the statistics are that 8 out of 100,000 first-time C-sections do result in the death of the mother, and 13 out of 100,000 repeat C-sections. Meanwhile, 75% of women who attempt a vaginal birth after having a C-section for a previous birth are successful in having that vaginal birth. It's called VBAC, vaginal birth after C-section. And we also know that having a doula present can reduce aspects like fear and stress. And when you have fear or stress at your birth, what happens in your nervous system is that the actual birthing process shuts down because there are nerves that control the fight or flight response, which are triggered when you're feeling upset, stressed, or afraid. And those nerves are controlling your body's functions to get out of the situation, run away, or fight for your life. And they are very much opposite to the functions of your parasympathetic nervous system, which controls things like rest, digest, and procreate functions of your body, including delivering your baby, bringing your baby down, and having strong, productive contractions in your uterus rather than spastic ones that are very painful. And also having the presence of a female support person who's outside of your social circle has been the way that women have delivered their children for millennia. It's very traditional. The model of having a medicalized birth with just you and your partner who have probably never attended a birth before or seen it, and it's just kind of you two and your midwife or your OB, it's very unusual in the context of human history. And so having some comfort there and having someone who can kind of look you in the eye, coach you on your breathing, bring you back to your focus, do some acupressure points or pressure points or massage or certain kinds of changing your position, for example, can do a lot to help you alleviate and manage pain, feel more comfortable, feel more supported and less afraid so that you can focus on what you need to do, which is bring your baby into the world. So I hope that helps you understand the bigger context of why having a doula is so valuable to your birth. And if you have any other questions about doula care, then please don't hesitate to get in touch with us. Both Dr. Antoinette and I do attend births in the Guelph area, and we also have an amazing network of fellow doulas here in the area, so that if we're not able to help you, since we only can take on one birthing family per due date, and we have about a month where we are on call, potentially, so we take one couple at a time, And so if we're not able to attend for your dates, we definitely have people we can send you on to, and would love to help you have a safe and satisfactory birth that you feel good about and where you feel empowered. So let us know if you need any help with that. Website is www.tworivershealth.ca, and talk to you soon.